Hi everyone, my name is Jessica Alfaro and I will be doing my presentation on the public health issue of obesity. Obesity has been defined as a person's weight being higher than what their healthy weight for their height is said to be. A person can be diagnosed as obese by looking at their body mass index, where a person that has a body mass of 30 kilograms M2 or greater are considered obese. Those that have a higher risk of becoming obese are those who have a combination of genetic susceptibility, have access to foods high in energy and calories, and those who don't get much physical activity. This includes people who don't have much access to fresh grocery stores or supermarkets and really just have to buy at the corner store who carries foods with high sugar and that are high in calories. Obesity has affected so many lives that it is now considered an epidemic. It has begun to affect all areas of the world's population and isn't just a physical issue anymore. Other than affecting people physically, it causes other conditions and diseases that threaten the well-being of its victims. Those who are obese have a higher chance of developing diabetes, certain types of cancers, coronary heart disease, sleeping disorders, etc. Due to the combination of different conditions and diseases, those who are obese have a higher chance of a quicker and/or sudden death. Obesity affects people in different ways and affects people of different backgrounds in different ways. For example, someone who was born in a low-income environment will be affected by obesity differently than someone who was wealthy growing up. It is estimated that about 500 people in the world are obese, and in which 1 in 3 people in the United States are obese. If numbers continue to rise, it is estimated that by the year 2030, there will be about 1 million adults obese if action isn't taken. Obesity can affect anyone of any gender, sex, age group, etc. Looking at different percentages among different age groups concludes that obesity is more frequent among adults than in children, especially those who are 20 years or older. The table shows that adults 20 years or older have an obesity rate of 42.5%, those ages 12 to 19 have a 21.2%, those who are ages 6 to 11 have a 20.3%, and ages 2 to 5 have a 13.4%. Gender and socioeconomic status. Studies show that between men and women, obesity is more common in women than in men. Part of the reason is that in women, obesity is related to depression, in which that isn't the case among men. Regardless of gender, in both women and men, socioeconomic status contribute to the chances of individuals becoming obese. Data has shown that those who received more education and get a degree have a lower chance of becoming obese in comparison to those who received less education, such as those who went to just middle school or high school have a higher chance of becoming obese than those who went to college. Diseases and mortality amongst the obese. Obesity is the second leading cause of preventable deaths in the United States. The World Health Organization has found that at least 2.8 million people die each year due to being obese, and 65% of the world's population lives in countries where obesity kills more than being underweight. Since obesity causes other diseases, the obese population make up 44% of the diabetic burden, 23% of the heart disease burden, and between 7 and 41% of those who are obese are living in these conditions. The role of schools in obesity prevention. A pivotal action that has been put into place to prevent obesity is in schools where children spend most of their days and where the young are influenced most often. Interventions have been done for schools to change their food environments by reducing the number of food that they have that are fattening and instead opting for a healthier alternative. For example, instead of offering chips and candy in vending machines, schools should provide healthier options like fruits and vegetables. This is not only asked for in vending machines, but also in the lunches schools provide as well. Efforts have also pushed schools to make physical activity a priority in the kids' teachings. Since states use standardized tests to hold schools and students academically accountable, physical activity and recess have become a lower priority. But luckily, now some states are mandating and promoting more physical activity in schools. Some schools also now provide screening, health information, and doctor referrals for kids, especially those who are low-income students, those who are at high risk of obesity, those who tend to be underinsured and may not receive health services in other places. Pediatricians' roles in obesity. It has been shown that doctors play a significant role in preventing obesity, especially pediatricians. Pediatricians play a big role in children's lives by providing healthy lifestyles for families and advising them to follow the appropriate steps to living in a healthy lifestyle. They should promote a better diet that strays them away from unhealthy foods and creates a better eating habits among kids. like encouraging them to have a diet free of sugar-sweetened beverages or cereals and having fewer foods with high calorie density, and instead increasing intake of fruits and vegetables. They should also promote the lifestyle that includes getting more physical activity rather than sitting or lying down most of the day. Prevention. The primary prevention for obesity is individuals should focus on maintaining a healthy weight, eating nutritious foods by limiting intake on foods with high fats and sugars, engaging in physical activity at least a few minutes a day, and speaking to your doctor about your weight and how to maintain a healthy weight. The secondary prevention would be to be in constant checkup with your doctor and avoid gaining more weight. Also, it's important to follow doctor's recommendations, just like pediatricians do for the young, where they promote a healthy lifestyle. General doctors are to do the same for adults in order to lower obesity rates. The tertiary prevention would be that when someone has been confirmed obese, they should make better health choices. They should also avoid getting worse, not only in terms of weight, but also other diseases from the consequences of obesity. For example, if someone has diabetes, they should make sure to be going to the correct doctor to avoid any further complications like cardiovascular diseases, heart attacks, or strokes, and just to know how to control their diabetes. In addition, it is important to monitor one's sugar levels to avoid relapse that could send the individual to the hospital or to lay the limb. Overall, obesity is a rising problem, and as numbers rise, the more people get other diseases or even worse, die. Action should be taken not only for the adults, but also for the young who are the future of this world. Different disparities get affected differently, but if nothing is done, everyone sooner or later will be affected by this killing epidemic.